Our next guest is Dr. Roger Mazlen. Dr. Mazlen is a nationally recognized expert in the diagnosis and treatment of chronic fatigue syndrome, or chronic fatigue dysfunction syndrome as it's sometimes called. He's made numerous radio and cable television appearances in which he has shared his expertise in this growing public and private health menace. He's an internist and specialist in clinical nutrition, a senior member of the Division of Endocrinology and Metabolism at the Mount Sinai Medical Center in New York City. Dr. Mazlen is a member of a number of important medical organizations and is a fellow of the American College of Nutrition, of which he is a past director and secretary-treasurer. Now to talk with Dr. Mazlen, here once again is John.
Roger, tonight I'd like to address the three key areas we collaborate on: chronic fatigue, prostate cancer, and AIDS. And I thought it would be informative to begin with a brief talk on the concept of immune modulation at the cellular levels. What is the role of glutathione in the cell, and more specifically, the role of glutathione in the immune cell and its effect on immunomodulation?
Well, we know from the AIDS model that glutathione is critical to the immune cell because when the CD4 or so-called helper immune cells, or T helper cells as they're also called, are damaged by the AIDS virus, the intracellular level of glutathione plummets, and these cells are not restored to their functional capacity unless the glutathione levels are raised. In fact, that was one of the early studies was on a specific compound called NAC, which was shown to raise the level of 27 patients who had AIDS. And unfortunately, but important to note that when there were low glutathione levels in the CD4 cells, the percentage of patients who went on to die increased. So not only is the immune modulation of the immune cells a critical factor, but in some people it's actually life-threatening. Now, fortunately, we're talking about AIDS, and there are a lot of other entities and diseases in which glutathione levels are lowered, which are not that serious.
Roger, you're familiar with the data generated from a pilot study completed by Dr. Paul Cheney in treating chronic fatigue patients with Immunical. What is your opinion on the pathogenesis of this complex syndrome?
Well, the pathogenesis of the chronic fatigue syndrome is not fully elucidated to date, but we know for a fact that patients acquire multiple infectious processes, and as a result, their levels of glutathione are reduced by this type of stress. In fact, studies have shown that even something as simple as elective surgery will decrease glutathione levels in the liver cells markedly one day after the operation. So multiple infections, which can be far more serious than elective surgery, are a severe stress on the immune system levels of glutathione, and glutathione is associated in cells in the immune system with an increased ability to secrete interferon, which is a natural antiviral compound. And so if this mechanism is impaired, in essence, these patients are more susceptible to develop viral infections, and that's what's been seen. And Cheney has documented that Immunical, and given to patients in a series that he conducted at his office in the Carolinas, in approximately 70% gave clinical improvement associated with increased levels of glutathione in the cellular area.
You mentioned improved glutathione. What is the difference between the delivery systems of Immunical and that of OTC or NAC?
The key here is, because we had mentioned this as one of the earliest studies on the AIDS patients, is that NAC potentially has serious toxicity. Now, there have been a variety of studies, and some have been short-term, and the amount of NAC that was used was monitored, but unfortunately, when you're giving something to somebody over the counter, it's hard to suppress their desire to take more if they think they're going to get better by taking more. And that is one area which bothers me about attempting to use NAC to raise the glutathione levels. Plus, it's not as efficient as Immunical. Immunical is a much more effective way of actually building up the intracellular level of glutathione. There are other ways that have been attempted, and years ago people were buying glutathione itself. However, it was very easily demonstrated that by taking the glutathione by itself, that it was being broken down in the gastrointestinal tract and actually was not becoming available to the cells whatsoever.
Do you have any recent information on the effect of Immunical in patients with cancer of the prostate?
Well, I've been looking at this area. We don't have a large series yet of patients that we've applied the protocol for using Immunical to yet. Hopefully we will expand understand it because the results thus far have been dramatic. We've been taking patients who either have failed on chemotherapy for one reason or another, or where the chemotherapy was toxic and they could not take it anymore. We have one patient we're following for over a year who was considered to be terminal when he started on Immunocal, having had a very serious cardiac toxicity. He actually had damage to his heart muscle, and when that occurs, you have to stop the chemotherapy immediately. And he was put on Immunocal when his PSA was approximately 208, and within 2 months, his PSA had decreased dramatically to 11. His sense of well-being was restored, and subsequently, during that period of time, he was found to no longer have any metastatic spread, which he had right before he started on Immunocal. Now, I'm not saying the Immunocal was a chemotherapy. I'm saying it's an immunotherapy. And so it was used in an adjunctive way, but it gave very dramatic improvement, and this patient has maintained the improvement over a year, which I think is startling. He's just, has now, as far as we know, a small residual area of local recurrence, but it's not widespread, and that's been treated with an additional short course of chemotherapy recently. But the main point being that the Immunocal is associated with a dramatic improvement and has been sustained, and we're actively looking for more patients like him.
Immunotech is currently involved in a trial on wasting syndrome that's being overseen by Dr. Diana Williamson. What's your opinion of the effect of glutathione replenishment in AIDS?
We're fortunate to have had some studies that show that the Immunocal specifically and glutathione replenishment in a general sense are very beneficial to the wasting syndrome, which, starts with a greater than 10% decrease in body weight. And, these people, if they only achieve an improvement in quality of life, it's a substantial clinical benefit because we're not saying that Immunocal kills the virus. We're saying that it treats this wasting syndrome. But now we have, and of course when she's finished with her study, we'll look forward to hearing of her results. But we do have clinical trials which have been done in a variety of places showing that increasing the cellular levels of glutathione is associated with improvement and sometimes dramatic improvement in the wasting syndrome associated with AIDS.
And this last question, how do you see the future of whey protein concentrates as a cysteine donor in the treatment of diseases?
I see it as one of the bright new horizons for the coming millennial year. I'm very excited about the work that's being done by Immunotech Research Limited, and I'm looking forward very much to new developments and new scientific progress, both in cancer and immune-related diseases and infectious diseases like AIDS. But I think all this portends for a very bright future, and I'm very anxious to be a part of it.